Hello, my name is Pat Hannon, and today I'm going to talk to you about conceptual change. I'm going to define conceptual change. I'm going to tell you why it's necessary in my field. I'm going to let you know what is needed for conceptual change to occur. And then I'm going to give you a quick demonstration of some instruction that is meant to foster conceptual change. To define conceptual change is generally defined as learning that changes an existing conception. As an example, it's either the belief, the idea, or way of thinking. Conceptual change is a challenge that all instructors face when introducing new material to a well-educated group of students. And what I mean by that is every student comes into the class with his or her beliefs about a given topic. And if the information that the instructor is trying to pass on to the students conflicts with their beliefs, then the student has to decide which information is correct. Now, if they decide that what the instructor is presenting is correct, then that changes their conception of that belief or that concept. Why is it necessary in my field? And I work at USF-SAM. And the reason it's necessary is, and the example I'm going to give you is I have two courses that we work with. We have the flight docs and the aeromedical evacuation technicians. And then we also have our second course, which is your flight doctors. Okay. They come to the school and they are already technicians, nurses, and doctors. They already are pretty well versed in the medical field. They're experts and they're actually selected to come and become flight nurses, aeromedical evacuation technicians, and flight docs. Okay, so they're the cream of the crop when we get them. But they come in with some beliefs and they believe that they understand how the human body works and how to treat it. Okay, but the differences or the problems with that and why it's important is we now have to get them to believe that the human body reacts differently to injuries and treatment and medications at altitude than it does in the ground. And again, this is a new concept that we're introducing to them. Another thing that we have to get them used to is that they're used to working in a hospital or a clinic where basically all the equipment is just around the corner if you need it. Well, they only get the equipment that they bring on board the aircraft. There is no supply cabinet down the hall. The second thing is that they can't, call and ask for additional staff. They work in that three-person team, the tech, the doc, and the nurse, and that is all they get. The best they could ask for help is the crew chief on the aircraft themselves, but they're not medical, they're in charge of the aircraft. But that's about the only help that they can get while they're up in the air. Another concept that we really have to kind of get them used to is that communication will be difficult due to noise, possibly smoke, and low light conditions. And then what is normally another team's member responsibility may all of a sudden become theirs. So again, where they're used to dividing up the responsibilities, they may have to pitch in and help each other out. And lastly, don't forget about the second patient. Most of the time when they're flying with more than one patient. And of course, Murphy's Law is that as soon as you start to ignore one patient, something's going to go wrong with that patient. And then what is needed for conceptual change to occur? There are four things that are needed. Dissatisfaction with the current concept or the current belief that they have. The new one has to be intelligible. It has to be plausible, and it also has to appear to be fruitful. In other words, there has to be a benefit from accepting the new idea. And I'm going to demonstrate this with a little, where I'm going to use the refutation concept in order to demonstrate this. And I'm going to break it down into the three parts of it. The first thing is the misconception. The misconception in this case is that doctors, nurses, and technicians know how to take care of their patients. The refutation cue is that they don't know how to do it at altitude. And the current accepted scientific explanation is that the human body reacts differently to injuries and treatment at altitude. An example of that is Boyle's law of gases. The human body, because of the altitude, there's less pressure, so some of those gases expand, which causes the difference in the reaction. Today I talked about conceptual change. I gave you the definition of conceptual change and why it is necessary in my field. I also talked about what is needed for conceptual change to occur, and I gave you a real quick demonstration of instruction that is meant to foster conceptual change. Thank you very much.